Well, and this Thursday, we can officially say it's fall. And coincidentally, this Thursday also marks Fall Prevention Awareness Day.
Yes, and here with some helpful tips to prevent falls is nurse practitioner Mary Nara with HealthCare Partners Medical Group. Good morning, Mary.
Good morning. Thanks for having me.
Oh, you're so welcome. Why is it so important to educate people about falls?
Well, falls are really frighteningly common. I myself fell about a week ago.
Oh my goodness.
Fortunately, only scrapes and bruises. But the incidence of falls really high. So in the next year, 1 out of 3 adults over 65 will suffer a fall. And in the course of that fall, 20 to 30% will have an injury like a cut or laceration, a broken bone or fracture, or even head trauma.
Yeah. Well, I mean, luckily at our age, we take the fall, we can usually shake it off. But for senior community, falls are a very serious issue.
Absolutely. Older Americans are really at more risk for serious injury because of multiple reasons. First, there's a ton of medical conditions that predispose older adults to fall. Nerve damage, wear and tear on bones and joints. And then also there's a high incidence of osteoporosis in Americans over 50. So there's 10 million people over 50 with osteoporosis. Osteoporosis is a thinning of the bone, makes the bones more porous and more susceptible to fracture.
Wow.
Is there anything that people can do to prevent osteoporosis or just keep their bones healthy?
Absolutely. Probably the most important thing is to do regular physical activity, just even something as simple as walking that's weight bearing to keep muscles strong and bones healthy.
Isn't it interesting that the pressure of exercise and walking actually helps your bones?
No question.
I think it would be something you ate, but it's not.
Well, there's also some things in the diet. Calcium and vitamin D are really important for bone health. In regular diets, calcium's pretty easy to do. Dairy is okay, unless you have a lactose intolerance or something. Vitamin D is a little bit more challenging, but equally important for bone health. The only real dietary source I can think of is whole milk. So you can be tested for vitamin D levels, and a supplement can be recommended if your levels are low.
Awesome. I mean, when it comes to obviously seeing your loved ones, you want to help them prevent falls. How do you do that? Is it like retrofitting a house, trying to make it a little less trip worthy?
There's lots of things, but my top 2 are like environmental things. So clearing a pathway where you're walking frequently, having good lighting so you can see where you're going even if you're getting up in the middle of the night, avoiding throw rugs or things you can trip over, avoid open-toe shoes. If you have a walker or a cane from your medical provider, you should use it. And then the second big one is medication. There's a ton of medications that contribute to falls by causing dizziness. It ranges from high blood pressure medicine to over-the-counter allergy medicine to sleep and pain medication. So it's super important that your medical provider knows all the medication you're taking.
Wow.
So over at HealthCare Partners, you have something called the Model of Care.
Total model care, yeah.
Total care model.
Oh, you know all about it.
Well, I am a HealthCare Partners member.
Oh, well,
That's
there
what
you
I
go.
do.
Well, why don't you tell us about it then,
So let me tell you something about Total Care. Here's why I like
What is
HealthCare
it?
Partners.
I'm new.
The fact that it's all under one umbrella. If you go to one HealthCare Partners and then you go to a specialist, you're all on the same game plan. Am I right?
Yeah, so the total care model focuses on like screening and prevention, patient education, and then coordinating care for patients between specialists and the primary care provider and between the hospital and the primary care provider. So we have a lot of teammates that are involved in that, including care managers, social workers, lots of behind-the-scene teammates to help coordinate that care.
And here's the thing that I hate. Whenever I go to a specialist or something that's not my main doctor, you would go to a place and you have to fill out 15 pages of paperwork so you can tell them who you are. And then they have to wait for my doctor to fax something to their office. If you go to HealthCare Partners, it's all within the same thing. You have electronic medical records that go throughout the entire network.
Yes, there are several specialties within HealthCare Partners, and we do, for the most part, share an electronic medical record system, so the patient record is easily available to everyone.
That's awesome.
Excellent. I get it. Yeah, well, for somebody like me, Sean obviously knows a lot about it.
Sorry.
But for myself and other people who might be interested, how can we learn more about HealthCare Partners?
So HealthCare Partners will be hosting multiple events around the city, and there's a website that people can go to learn more about those events and find the nearest one to them.
Awesome, very
Yeah.
cool. And I know we're open enrollment's coming very soon.
Yes, October.
Going to be a busy time for you guys.
Yes, always is.
A lot of questions, and I know people can get answers through the HealthCare Partners website and through their doctor as well.
Absolutely.
All right, it's great having you. Thank you so much.
Thank you, Mary.
Thank you very, very much.
All right, if you want to help protect your loved ones from dangerous falls and you want more information on HealthCare Partners Medical Group, you can visit the website on your screen. A lot of events going on at that website. Plus, you can follow them on Facebook and Twitter as well. And while you're on Facebook and Twitter, like and follow us. We need the numbers.
Yeah.